I had to give special thanks to Dr. Fang Ben Zheng, my teacher. He taught me since 2007. So until now, it's already 14 years. So this is my philosophy. With things related to saving people, there's no need to keep secret. Today, my job is very simple, but it's the most complicated. Is how can I inject this image in your brain? And then whenever you look at the skull, the head, and that image show up in your brain, inside of your brain. Like traditional Chinese medicine doctors always say, let me watch your pulse. Nobody say, feel your pulse. Have you ever thought about that? And because your finger is just like a probe, okay? When you put your fingers on person's pulse, immediately the image comes to your brain. You actually see a human body. And when the pulse, every time the pulse beats and the image go into your brain, and it's almost like a CT scan, 3D dimension. You almost can see all upper layer, middle layer, lower layer, and then each pulse have 5 lines. Okay, and then you can 3D recreate 3D image of this body. That's why we say we see the pulse. And if you really want to master traditional Chinese medicine, the most important thing is to see the picture in your brain. Whenever you see the patient, all the image come to your brain, you got it. You have to use this point. There's nothing else you can do, right? And then in order for you to reach that level, for me, I feel there's 1, 2, 3, 4, 5, 6 layers have to lay on top of each other. And today is only on the module of tools, which means I use acupuncture. And then one of my tools is called Fang Scalp Acupuncture. Okay, it's so many layers of the theory to identify the location or the points you want to, or the method you want to use, and then finally you want to, okay, now this time I want to use acupuncture. Or maybe you can use herbal medicine. You can also use Tai Chi meditation. You can use Qigong exercise. Even you can use by talking to them. They already get healed. There's so many ways you can do, but you have to make sure that all your method is follow the 6 layers of information. And then you can even use Western medicine. Yeah, you can use drugs to help patients if you follow the rules. As many you probably know me, but some of you haven't followed me on the clinic. I'll just briefly talk about myself. The reason why I say this is I truly hope, I truly have a feeling that if I can do it, you can do it. Okay. Yeah, I see 4 to 5 patients per hour, and 99% of my patients all use acupuncture. Only 1% tell me that they only want to use herbs. And then among all the patients who use herbs, 20% of the patients actually use acupuncture and herbs. And then among all the patients who take herbs, 80% I just use powder format. And 20% of the herbs, usually for patients who have cancer, I will use herbal medicine because it's more complicated. It's pretty hard to use only the powder formula. So this time, 5 branches invited me to talk on a live, class on using powder herbs to treat COVID-19. So I treat 18 patients of COVID-19 just using Sanghanlun theory and using powder herbs. Pretty effective. Most of the people they recover within 3 days. So I already briefly talk about how I practice the diagnosis methods. I give a name, with my help my husband. It's called unifying principles, called UP method. Okay, within this UP method, there's 6 layers of it. So I use channel theory, which many of you already know. I use Zhangfu organ theory, which everybody learned in the school. Okay, I use Sanghanlun 6 channel theories, which use this to direct my acupuncture. You can use the 6 channel theory to direct the acupuncture point to use, not only for the formula. And yeah, it is quite fascinating. And I am very enjoying it. And then there's a 5 ring 6 qi theory. the 560 theory is very, very important because we live in the universe and we are affected by the weather every day. Just like this year's weather is water transformation deficiency year. Okay, just everybody look outside of your window. What kind of weather we have today? Huh? Very gloomy, right? Cold, damp, which is exactly right that what the 560 talks about today's weather this year. Okay, it's this year's weather is gonna be super damp in the first half of the year, and the second half of the year is coldness. And then people who born in the year of one, they'll be pretty complicated. Okay, so they will always have problems of a water transportation issue. Means the body will have water accumulated by the deficiency of the kidney. So if you think that that is the baseline that will affect everybody on the earth, what will you do to help your patient? Doesn't matter what kind of problem they come to you. It could be a headache. It could be a heart failure. It could be something like digestion issue. Okay, it could be a pain in the left side of the shoulder. It could be the pain in the right side of the leg. Have you ever think about that's affected by the weather? In the school, of course, everybody tells you, yeah, well, heaven and the human are one, and the weather really affects our body. But we really never put that into application. And there is a way to also encrypt that aspect of the knowledge into your acupuncture practice, and which is very effective too. And then I use the 5-element theory, and then this 5-element theory also direct the 5 shu points, which I already taught a couple classes in 5 branches. Is very useful. This if you wanted to treat chronic illness, okay, you cannot poke the liver, just like the way how you say, oh, shoulder pain, poke the shoulder, right? Or if you have arm pain, you poke the arm. You cannot poke your liver. Well, of course you can poke your stomach. That actually will help the repair. There's a method to do that. But then, you cannot poke your lung. Now, how can you help the lung to alleviate the problems? You have to use the channel and the 5 shu point to change the function of it. And then, of course, the pulse and tongue diagnosis is very important. Yeah, the channel theory and the Shanghai Lun 6-channel theory is one system. It's one system. It's not separated. Yeah, if in the future with time, we'll talk about that too. Yeah, it's very fascinating. If you see they are together, then you can do so many things. If you still in your mind, oh, they're all different system, and some students ask me, it says, oh, in the school, it talked about that. Sometimes we will have to ignore the pulse and just look at the tongue, or ignore the tongue, just look at the pulse. And then what will you think? I say, there's no such a thing. When you say ignore the tongue and take the pulse, it's just because you don't know how to interpret the tongue to match the pulse. It's not like the tongue is not right, the pulse is right. They're always match. They're always match. Okay. It just depends on if you know how to interpret it. So if you learn the Fang Scalp Acupuncture, you're not only learning the image you see, I will teach you the pattern. How can you use the scalp acupuncture to strengthen the circulation in the liver, to move the blood that's stagnated in your intestine, and how can you improve the respiration, okay, in your lung. And then this is all workable. And that's why I only use 20% of the patient. I used to use a lot of herbs because when I was training in Zhejiang TCM University, and my teacher, all my teachers are very good in formula. So I use formula a lot, almost about 60%, 50 to 60% for chronic illness. I always give herbs. Of course, you will make more money because if you give herbs to all your patients, right? But unfortunately, in US, a lot of people don't like to drink herbs, and they're really questioning about where the source is. If there's heavy metal, it's gonna interact with my drugs. Oh man, nonstop. And then it's okay. And then I start to think about it. Okay, no problem. I'm going to just use acupuncture, and I don't believe that you have to use herbs. And then I was lucky, and then 2007 I met Dr. Fang, and then that's how I started to learn Fang scalp acupuncture, and then found out that I actually don't need to use that much herb anymore, and still doing a very good job. And then you can avoid so many drugs to drugs interactions and all that kind of issues. You just need to do acupuncture, and you already can help them. So very important. So in the tools, I use Fang scalp acupuncture is one of my tools, which I'm going to focus on today. And I use 5-point, and I use a lot of the holographic theory to image the parts of the body, and and also the mirror image in a holograph theory is slightly different. And I use a lot of mirror image after I start to practice Tai Chi, and I start to something down on me, and I found out, wow, this is quite fascinating. And then because of all this skills I get, and I found out most of the time when patient comes, when you following me and you ask me which point is that, I cannot tell you. There's no point. It's the point that patient really needs at this moment. Just like the stomach 36, it travels all the time. It travels up, it travels down, it travels left, it travels right. And how can you grasp the right stomach 36 right at this moment for this particular patient? Yeah, it's not like following the textbook and then just find the points all the time. We have to use our hands to palpate. Okay, and we have to learn all the holographic theories and the imaging theories, and you can create it so many points that you never thought about it. So then you will become that students, right? You forget all the posture, and then you just go there for free and just flow with the disease, flow with the disease. Whatever the signal comes to you, and then you know how to treat. And since I started to use scalp acupuncture till now, I already use about more than 12 years. And with my patient count, I already treat 70,000 patients. So a lot of practice. So a lot of people see me doing needles very fast because I just do it a lot already. So I'm very familiar with it. So you have to go there and practice. The more you practice, the more you're doing quick. And then when you do quick, and the patient don't feel much pain. Fang scalp acupuncture, why I like it: effective, precise, children friendly.